We started subnational estimation for Iran in 2018. And this paper that you are seeing, it is the result of the 3-year work on this area, that it's happened between 800 researchers and scientists in Iran and in the university, in the Institute of Health Metric and Evaluation in University of Washington. And this paper is the most comprehensive and evidence-based that explains situation of the health in Iran by all the province, and each province one by one, by age, by sex. And we put together, we check with the more than 800 collaborators that we have in the Iran, scientists and researchers and people that working in the Ministry of Health. We checked, and when we agreed that the result is correct, based on the evidence, based on the method, we put together in this paper. In this paper, we tried to show that each province, what is the situation in each province, which disease make more burden in some province and lower burden in other. And this is the first time that we will publish in the world burden of disease, effect of burden of disease by province, effect on the life expectancy.
One of the major findings of this study is the increase in life expectancy at birth in Iranian population. And this, of course, have been increasing during last 40 years, but especially during last 20 years, it has increased more than 10 years of life expectancy of all Iranian. And especially the life expectancy increase in women. And the life expectancy at birth in women is now close to 80 years, 79.6, while in men it is about 76.1. And also this life expectancy has increased all over the country in all provinces. And the disparity between provinces has declined, especially during last 20 years. And this is an evidence for really improving the health status and healthcare in Iran overall. One of the major reasons for this increase is actually the control of infectious disease and the decreasing the death rate in neonate infant and also the mothers. And the other one is the improvement in injuries. We have a very high rate of injuries in the past, and it has declined. Injuries, especially the car accident, which is still a major problem, but it has declined during last 20 years.
Iran has a very, very good and important primary health care system, especially in the rural area, that came from the WHO in 1970, 1960, based on the all of the experience that started in 1970 and 1960 in northwest of Iran, and then expanded, and in the around 2000, 2010, we had a very important result for these primary health care system in rural area, especially in the rural area now. For some indicator, we have much better than urban area. In Iran, we have integration between medical education and health system that it is not usual in the other country.
One major problem is that actually the pattern of disease has changed from the infectious disease to non-communicable disease. And this is mainly due to the risk factors like overeating, obesity, hypertension, hyperlipidemia, diabetes that has become very common in Iran. Therefore, the major challenge actually in the future is to control a non-communicable disease. The most common cause of this is actually the myocardial infarction. And our studies during the last 10 years have shown that we can easily control actually these NCDs if we have planned for it. One major problem actually in Iran in the past was that this gender inequality. And during the last 40 and especially during the last 20 years, the gender disparity has declined dramatically. Even in medical schools, now we have more female students than the male student at present time in Iran. And the opportunity for female to be more active and also to have a much better health status in Iran is now improving, and almost there is no disparity. If anything, it's mainly for male, not female, in the health. As is very well clear in this paper, one of the major actually development in our healthcare system is the improvement of child and maternal health and a dramatic decline in the neonatal infant and child, 5-year child mortality, and also a very good care for mothers. As a matter of fact, even in rural area, we now have a very, very well-developed healthcare. We call it the health network, health houses for every almost villages, close to 100% of the country for remote rural area. And also we have a special system for care of the mothers for delivery. And these are small units, even in village, which provide care for female in rural area.
We open the window for all Iranian researchers, scientists to use result of the global burden of disease by province in Iran from 1990 until 2019, and soon we will publish from 1990 by 2020. I hope that this paper can help Ministry of Health, health worker, and scientists in Iran for the improving of the public health in Iran.